Hi, welcome to the third professional webinar for the Path2BSN program. Today, the professional webinar is on professional development in nursing. So whether you are a nursing student or a working RN, this information applies to you and to the importance of continuing to grow and learn in our healthcare profession. I am Dr. Tracy Taylor, and I'm the nurse educator for the Path2BSN program at Ohio State University. Throughout this program, we provide educational webinars on important topics when practicing in nursing. So let's get started. When we talk about the importance of professional development, we want to look back at one of the icons in nursing, and that is Florence Nightingale. Florence Nightingale stated, "Let us never consider ourselves finished nurses. We must be learning all of our lives." This is back in the 1800s, and so that kind of foreshadowed the need for nurses to constantly learn and adapt to be key contributors in healthcare. In Florence's time, they were learning about hand washing and the prevention of infection. It was really the key to survival for many during those battles and wars and the care that was provided. Many of those processes are still continued today and have really developed into some of the practices that we still use. This mandate has never been more important than it is today, as nurses strive to meet the constantly changing demands of today's complex healthcare system. If we look back at this past year, our frontline nurses had to adapt overnight to changes in isolation, infection control procedures that included many types of things like decrease in supplies or no supplies, learning fast the signs and symptoms of the coronavirus, patient responses to the symptoms and treatments, and also caring for patients in isolation with no family contact. They had to work as a team. They had to be resilient, and they had to learn interventions as we were trialing them and they were being developed. So they were in a constant stage of learning every time they were on the front line. We also want to look at the definition of professional development. And so looking at that, we move towards a professional organization in nursing, and that's the American Nurses Association. And they define professional development as a vital phase of lifelong learning in which nurses engage to develop and maintain competence, enhance professional nursing practice, and support achievement of career goals. The ANA focused in earlier versions of their standards on more of the relationship between continuing education and staff development. And so many times that comprised of orientations, in-services, and continuing education. Over the years, the model really evolved using more of a systems approach. There became a nursing professional development certification, and that included responsibilities about the roles, the learners, and change in professional role competence and growth. And this really impacted ultimately the care and health and protection of our public. The ANA also provides our code of ethics. And in provision 5, the ANA states that the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continued personal and professional growth. So as a nurse, you're owing the duty to remain competent for your patient and growing in your education for your patient, but also you need to have that same duty apply to yourself. When we look at professional development, we want to see if there's any issues or concerns in healthcare with professional development. And one of the areas is that constant change, the changing environment, role changes. The roles of healthcare providers are changing drastically. More care is being provided outside of that acute care setting and in an outpatient care type of setting. We have more clinics than we've ever had. We have home care. We have all other specialized kinds of care facilities. Some of the certified nurse professional development practitioners had to really expand their role in order to support the transition of nurses and other healthcare team members across learning and practice environments. So, with new practice arenas and areas to practice comes new roles for nurses. And the Future of Nursing report in 2010 from the Institute of Medicine really challenged nurses to assume new and expanded roles to help meet those evolving needs of healthcare systems. And so we have some different roles now that we may not have seen before in nursing. We have nurse navigators, we have health coaches, we have more roles in community health workers, and new roles in nursing informatics, telehealth, and patient safety. Telehealth was on the brink of rising the last 3 to 5 years, but when the pandemic hit, telehealth was full force into being a key factor in people receiving care. As clinics and offices were shut down and people were in their homes, some of the only means of communication for their health was telehealth. So we had to really grow and learn in a very quick amount of time. Nursing as a profession, in associations such as that nursing professional development certification, they're working on ways to increase diversity in the nursing field. We need to have very diverse practitioners in this age to help meet the needs of our diverse population. And lastly, the organization resources. When we talk about professional development, we also consider that return on investment for the organization. Organizations used to provide tuition reimbursement, professional development, seminars, webinars, courses, certificates, all kinds of opportunities. And as budget cuts happen and streamlining happened, sometimes many of those things went away. And so return on investment is if the organization invests in those things, what will they see in return? How will that benefit that healthcare system in return? And so that professional nursing development, the certification, their role can help show an organization what that return on investment can be. Ways that if you invest in professional development for your healthcare workers, how can it benefit your organization? So these are just some of the things that really can facilitate in the role of development, but it could also be an issue or concern if those things are not met for those organizations. Now let's look at the benefits that we can have from professional development. It can remove practice barriers. It can increase opportunities to lead and collaborate. It can increase higher education in nursing. It increases engagement in lifelong learning. It also provides opportunities for nursing to lead change. Again, when we talk about in 2010, the Future of Nursing report, that was a collaboration with the Robert Wood Johnson Foundation and the Institute of Medicine. And they formed that group in order to make recommendations for the future of nursing. They recognize the importance of pre-licensure and ongoing education for nurses in a healthcare system that was really striving to constantly improve patient care outcomes. The recommendations confirm the very important leadership role for nurses in the healthcare system. They wanted to ensure that policies were in place that promoted nurses working to the full extent of their education and training. Also promoting that they expand the role and scope of practice relative to the competencies aligned with the level of a nurse's education. They made sure that that was very essential. And state by state, for an RN, they have your scope of practice, what you are allowed to do at each level as a registered nurse. Professional development also includes ongoing education, and it can foster other avenues for advancement, such as clinical and career ladders. So many healthcare facilities have something that's called a career ladder or clinical ladder, and that is a way in your professional development that you can advance throughout the system as a nurse. And there's different incentives, and it also helps you grow professionally each step of those ladders. Um, they also wanted to collaborate with other healthcare disciplines and develop interprofessional learning opportunities and promote that collaboration among disciplines. So we saw a very big increase in simulation education on interprofessional collaboration and education so that we're all working together as a team. We understand the different disciplines we're working with and what their scope of practices so that everyone is working for the best patient outcome. Formal and informal lifelong learning is very essential for nurses, and it's a way for them to stay relevant, especially as front leaders on the front line in healthcare. Supporting nurses in the development of leadership skills is a really big key role for education leaders. So, really identifying nurses in your facility with emerging leadership skills and developing nurses for current leadership roles. Again, we were charged in our profession to become leaders in healthcare. And so these are ways to support that in our nurses coming into some of those roles. Next, I wanted to give you an example of professional development. It's a very simple example. You are the staff responsible for in-service education of your unit on basic life support. So you may be a certified basic life support instructor, and you've been asked to do this for your unit. This is an example of a bedside nurse or charge nurse or team leader that has an opportunity to grow as a leader and mentor. Now that you've been asked to do that task, you'll have to make sure you're updated in your knowledge and skill with the latest evidence and skills in BLS as an instructor. This can lead to other opportunities, maybe designing the education and the training, and then that leads to another unit besides your own. This could lead to another department training, and then also system-wide in a network. So lots of opportunities to be a mentor to others and to grow. Next is kind of a personal touch on professional development. I want to introduce Dr. Katie Martini, who is faculty in our RN to BSN program. So if you are in our Path2BSN program, at some point you will have contact with her. And she is very involved in the professional development of our faculty and is excited to see faculty grow and learn so that we can adapt our teaching to you as students for what you are facing on the front lines and out in the healthcare practice environments. And so this is a short audio clip of her definition and impact of professional development.
Hello, I'm Dr. Katie Martini, and I've been asked to talk about professional development. As you go As you grow in your career as a nurse, remember that every successful person has been learning and working on developing their skills for a long time. Professional development, lifelong learning, continuing education is crucial to being successful and achieving career goals. As best practice continues to change, it's so important for us as clinicians to continue learning, practicing, and honing in on our skills. So you may be wondering what professional development is. Professional development is education and career training after a person has entered the workforce with the goal of helping us stay up to date on current trends and evolving issues, developing new skills, and possibly advancing our careers. There is some continuing education that is required to maintain our license, although many clinicians voluntarily seek out professional development opportunities in order to help us develop new skills, stay up to date on current trends, and advance our careers. It's important to keep current. I encourage you never to become complacent. Take ownership of your career, and you will be more likely to be happy, engaged, successful, and meet your career goals. Nurses who are engaged and seek out professional development opportunities are less likely to experience burnout. And some additional benefits to professional development are expanding in your knowledge base, either by helping to confirm something you already know or increase your expertise in a certain area. Professional development boosts confidence and credibility. Professional development increases earning potential and hireability. And taking a step to your BSN is a great place to start. There are also specialty certifications and additional degrees too. Professional development provides networking opportunity, and this is a great way to connect with other nurses and clinicians who are interested or passionate about similar things that you are. Your professional network and professional relationships really come into handy as you continue to grow in your career. And membership to professional nursing organizations are great ways to experience professional development and grow your professional network. Professional development keeps us current on trends and ever evolving issues in healthcare and helps us to embrace these changes. Professional development can open the door to future career changes by helping us to develop new skills, attitudes, and knowledge that just become and help us to become more valuable. So, how can you improve your professional development? Practice self care. Take time to reflect on your practice and ask for peer and client feedback too. Develop a timeline with milestones for your career. Talk to your boss about your goals so they can support you and let you know of additional trainings or development opportunities that may be helpful. Take advantage of every opportunity that comes your way. Be excited about professional development. Find a mentor, someone you look up to, someone whose career path you would like to emulate. This is a great way to learn from their experience, and many times they push you to be better.
I hope you enjoyed that short clip, giving you some tips about professional development and also noting that self care is part of that professional development. Dr. Martini did state in the beginning for working RNs, but I also want to add that the progression of professional development is a lifelong process and it requires active participation. And that starts as a student in any level of program you're in. Professional development does not end with graduation from nursing school. Rather, it begins when you pass the NCLEX, is what you will hear. But there are opportunities for skills and professional development as a student. And students going to school can be involved in student organizations. So that's the beginning of understanding professional organizations. Students can also be presenting presentations, poster presentations. They can be participating and involved in research as an assistant, as a volunteer, and also getting a job in healthcare while you're in school. is really increasing your knowledge and growing and exposing you to new knowledge. Faculty, they continue to develop at all levels throughout the year of teaching in the same manner. They apply learning to themselves personally and then also academically to benefit students like you in your education. The professional impact is that both students, faculty, and working healthcare workers together, we add to the progression of knowledge. We give a voice to our profession on every level that we are involved in. I wanted to talk about some resources for learning. And when you're working, the first one is work-based learning. So when you're working, you can learn by doing. You can also review case studies. You can be involved in reflective type practices. You may be involved in facility audits, coaching and mentoring from others. So many times you take a different position, a different role in your unit or department. And as you do that, you are being coached or mentored and getting feedback and evaluation. And that's the part where you are growing. That debriefing after you do something and the feedback and evaluation is a part of growing. Many facilities also include a peer review in your annual evaluations. And so that's where another peer anonymously reviews you. And so again, you're getting that feedback on things you can improve on or things you can grow in. Professional activity. And examples of that would be a professional body. So again, finding that professional organization that has a special interest that lies with you. So for example, if your interest is in psychiatric nursing, there is a national organization for psychiatric nurses. And so there's many professional bodies and many different specialty areas that you can choose from. Lecturing, teaching, mentoring, being a tutor, um, being involved in meetings, being the member of a professional body, and presenting at conferences, seminars, webinars. These are all ways to have professional activity. Formal and educational learning. Formal, taking formal courses, obtaining a higher degree in your field, being involved in research, conferences, publishing a paper or an article, attending seminars, distance learning, courses by professional organizations. For example, Sigma Theta Tau is the International Honor Society for Nursing, and they offer courses that you can take. Um, the NCSBN offers courses that you can take. And so that might be a way to get that education. Planning a class or course also involves formal education. Self-directed learning. For example, reading a journal or article on your own, reviewing a book, reviewing a procedure or an article is all part of increasing and making your learning up to date. Updating through technology like the internet, keeping track of your progress. The other section would be public service, volunteer type work. Many people have volunteered in the vaccination clinics during the pandemic. And so that is a way to give back, but it's also a way for learning, a resource for learning. Now, I just wanted to talk briefly about some development opportunities. This is not by any means a complete list. These are just some examples that you can refer to and you may want to look into. Professional organizations, we talked about that on a couple slides. You may be asking yourself, what's in it for me? And how can nursing organizations fit in my professional development? And the answer is it may very well be the backbone of professional development. When you're a member in a nursing organization, it unites you with peers. It You have a much stronger voice as you're united, and so that voice can be very strong depending on what organization you're in at the political arena, and that could be a local, state, or national level. Many memberships and professional nursing organizations, they provide nurses with continuing education opportunities, certification opportunities, role-related competencies, and educational conferences. And this occurs at a student level too. There are many student organizations for nurses too. Changes in healthcare occur almost daily. So, aligning with a nursing organization that supports your specialty or the population that you practice in really positions you to be on that forefront of practice changes. And nursing organizations promote and encourage the use of evidence based practice to its members. We also have listed here higher degree level, continued education, evidence based literature, specialty certifications, training, education, and clinical, employee and personal development plan. Many times at your annual review, you'll be asked to develop a goal for the next year and how you would go about achieving that with a plan. The clinical ladders that we talked about before, which is more of a reward system to help you grow professionally, conferences, presentations and posters, and services. I want to leave you with this quote: develop a passion for learning. If you do, you will never cease to grow. The passion to learn and offer the best care you can provide can make such an impact both personally and professionally. Thank you.